Dr. Starr Hampton is the Interim Chair and Chief for the Department of Obstetrics and Gynecology at Women and Infants Hospital. Dr. Hampton, thank you so much for joining us today.
Thank you for having me.
So let's talk about your annual trips to Rwanda. I know you've been going for the last 15 years. Can you tell me what you do every year when you go?
Yes, thank you. So for the past 15 years, I've been lucky enough to be part of a surgical team and now lead a surgical team of specialist providers who travels to Rwanda with our own nursing staff, our own anesthesiologists, and all of our own equipment really, to take care of women who have something called obstetric fistula, which we see rarely here in this country, thank goodness, because of our outstanding healthcare system. But in under-resourced areas, such as sub-Saharan Africa, obstetric fistula can be very common. And what that is it's a connection that happens for some women between either the bladder and the vagina or the bowel and the vagina during childbirth when they don't have adequate access to care or a hospital. And those connections obviously then create continuous either urine leakage or fecal leakage, which is obviously quite debilitating to women, creates a big social impact for the women who are then ostracized from their community, from their husbands, from their families. So my team and I go to Rwanda for a 2-week trip every January or February, depending, to triage women with this condition and then operate and close those connections so that they can then go on to lead a life without fecal or urine leakage.
Now, how many surgeries would you perform in this 2-week time?
Yeah, so my team goes and we have about 5 attending surgeons and we bring fellows with us as well who are surgeons in training. And we will triage approximately 150 women who present to our team. And that means that we do examinations, we try and figure out what's going on, and we make a plan for them based on those examinations. And during that time, we can usually operate on approximately 50 of those women. So not all 150 women are surgical candidates, and we try and operate on and help as many women as possible. But in general, with each mission, we can do about 50 surgeries.
So this is not only medical work, which it is, it's also personally satisfying work. What does this mean to you personally, performing these surgeries for these women in such great need on the other side of the world?
Yeah, thank you. It really is something that is so inspiring and something that I hope to include in my journey as a physician throughout my time, because it really reminds me why I became a physician in the first place. It reminds me of that connection that you can build with a patient even without speaking their language, just by giving them promise and hope that you can help them in the future and help restore their life for them. And it really just working with a team of providers who can do something for women that wouldn't normally have that opportunity and have that type of surgery in their country is really, really satisfying. It's one of the reasons why I also really feel very strongly about taking a learner with me during each mission. So each year that I go, I take my senior fellow, who's a surgeon in training, so that they can understand global health work and understand the impact of global health work and how much it means not only to the patients that you're taking care of, but to you personally as a physician, and how much it can really inspire you to keep going when you come back home.
Tell me something that a patient in Rwanda said to you that you still think about that really touched your heart.
Oh goodness, there are so many things. In fact, one of the just anecdote or interestingly, one of the things that I did one year when I went is I really felt as though when you read about obstetric fistula in the literature, meaning in scientific literature, everyone really focused on, did women get dry? Did they get wet? Were the surgeries successful? And I really felt that the voices of the women were missing from anything that was written about obstetric fistula work. And so one year we did a qualitative study where we did interviews with the women so that we could actually give them a voice. And we did publish that, which was really interesting and exciting. But the things that the women said, from as much as you gave me my life back and I pray to God every day, And, you know, now I can go home and have happiness again. I mean, when you read things like that, it just, your day can't get any better.
That really is beautiful. I mean, I have a little lump in my throat just hearing that. And you did that work for someone. You gave that to someone. So that really is beautiful.
Thanks. It's very, very rewarding.
Dr. Starr Hampton is Interim Chair and Chief for the Department of Obstetrics and Gynecology at Women and Infants Hospital. Starr, I can't thank you enough for joining us today.
Thank you so much.